Beta Blockers, a comprehensive guide. Welcome back to Nursing and Me. Today, we're diving into a must-know topic on beta blockers. These medications are a cornerstone of managing cardiovascular health, and by the end of this video, you'll have a clear understanding of how they work, their uses, potential side effects, and some key considerations. Let's dive right in. Beta blockers, also known as beta-adrenergic blockers, are a class of medications that primarily target the cardiovascular system. They block the effects of adrenaline, also called epinephrine, on beta receptors in your body. Here's how they work. Beta blockers bind to beta-adrenergic receptors, specifically beta-1 and beta-2 receptors. By doing so, they reduce the effects of the sympathetic nervous system, which slows the heart rate, decreases the force of contraction, and reduces blood pressure. Beta-1 receptors are primarily found in the heart. Blocking these receptors decreases heart rate and cardiac output, while beta-2 receptors are found in the lungs and blood vessels. Blocking these can lead to bronchoconstriction, which is why caution is needed in patients with asthma or COPD. Beta blockers are commonly prescribed to manage high blood pressure by reducing the workload on the heart, and they're also used to alleviate chest pain in angina by decreasing the heart's oxygen demand. For patients with heart failure, beta blockers like carvedilol have been shown to improve survival. Additionally, they're effective in controlling abnormal heart rhythms, such as atrial fibrillation, and are often prescribed after a heart attack to prevent further heart damage. Outside of cardiovascular uses, beta blockers can prevent migraines and even help manage physical symptoms of anxiety, like a racing heartbeat. Here are a few common beta blockers you'll encounter. Atenolol and metoprolol. These are called selective for beta-1 receptors in the heart. Next, we have propranolol. This is non-selective, meaning it blocks both beta-1 and beta-2 receptors. Third, we have carvedilol and labetalol. These are mixed beta and alpha blocking effects. Let's talk about their adverse effects. While beta blockers are highly effective, they can cause certain side effects. One of the most common is bradycardia, or a slow heart rate, which is why monitoring is crucial. Many patients report feeling fatigued or dizzy, especially when they first start taking beta blockers, and cold hands and feet can occur due to reduced circulation. For non-selective beta blockers like propranolol, bronchospasm can be a concern, especially for those with asthma. Finally, beta blockers can mask symptoms. When prescribing or taking beta blockers, keep these points in mind. First, always check the patient's heart rate and blood pressure before administering. Hold the dose if the heart rate is below 60 beats per minute or systolic blood pressure is below 90 mmHg. Second, use caution in patients with asthma, COPD, or diabetes. And lastly, never stop beta blockers abruptly. Tapering is essential to avoid rebound hypertension or tachycardia. Here's a quick tip to help you remember the names of beta blockers. Most of them end in lol, like metoprolol, propranolol, and carvedilol. Just think. Beta blockers keep your heart laughing out loud by taking off the pressure. And that's your guide to beta blockers. They're powerful tools for managing a variety of conditions, but as with any medication, it's crucial to know how to use them safely. If you found this video helpful, don't forget to like and share it with your fellow nursing and medical students.